Hello, everyone, and welcome to this module focused on compassionate caregiving for repetitive behaviors. Thank you for completing this module. Please make sure to complete the pretest before starting this session. Once again, I'm Dr. Sam Cotton with the University of Louisville Traeger Institute. And as I mentioned earlier, we're going to be focusing on repetitive behaviors today, really focusing on how you can incorporate compassionate care for individuals who are having this particular challenging behavior. And this particular module is really focused on, navigating those challenges of repetitive behaviors that are commonly exhibited by individuals with Alzheimer's disease and related dementias. We're going to focus on a number of different person-centered approaches, communication techniques, and really practical interventions that you can use to address repetitive behaviors while really focusing on preserving the dignity and well-being of those in your care. At the end of this module, you'll be able to demonstrate the ability to recognize and understand some of the underlying causes of repetitive thoughts and behaviors in persons with Alzheimer's disease and related dementias, using compassion, using empathy, using patience to really address their needs more effectively. You'll be able to develop and implement more person-centered strategies to really reduce repetitive thoughts and behaviors, really focusing on that individualized approach to managing these behaviors and really helping enhance the quality of life for persons with Alzheimer's disease and related dementias. We'll also talk about how you can foster a more compassionate and supportive environment for individuals, really helping to potentially prevent some of these challenging behaviors as well. So let's go ahead and dive right in and discuss what can contribute to some of the challenges that we see with repetitive behaviors for persons with Alzheimer's disease and related dementias, and some of the things you might need to know in order to provide care to individuals who are dealing with this particular set of behaviors. So when we're talking about repetitive behaviors, really in the context of Alzheimer's disease and related dementias, we're really referring to those actions or those activities that a person does on a regular basis that are repeated frequently and often without an apparent purpose. Sometimes repetitive behaviors can be detrimental to the individual and those around them. Sometimes those behaviors are really just soothing activities that person's engaging in, perhaps to really deal with some of the anxiety that they're facing, or maybe feelings of being overwhelmed in particular situations. However, these repetitive behaviors can be very distressing for both individuals with Alzheimer's disease and other types of dementias and their caregivers, because in general, these types of behaviors can really disrupt daily routines. They can cause frustration on the part of the caregiver, and can really be challenging to manage because we really have to spend some time really thinking about what's causing this particular behavior. Why is this individual really struggling in this particular space? A lot of times these behaviors are often the result of those cognitive changes that we see in persons with Alzheimer's disease and related dementias, and also some of those other challenges, not just the memory loss piece, but things like confusion, anxiety, that underlying need for structure and routine, really needing to know what to expect out of a particular situation. Really understanding the underlying causes and triggers of repetitive behavior and really thinking through strategies that can help manage these particular behaviors can really reduce their impact and potentially prevent them from happening in the future. We really want to focus on creating this calm and familiar environment, identifying what those unmet needs might be for an individual, providing that reassurance, and using distraction techniques when appropriate can really be helpful in terms of addressing this particular set of behaviors in a very supportive and a very compassionate manner. So what are repetitive behaviors? Now, for those of you who are working with individuals who are dealing with this particular challenging behavior, you might have seen this in the work that you're doing. These can be things like pacing or wandering without intent. So the individual's just pacing up and down a hallway. They're wandering around, not necessarily looking for anything in particular, but just always on the move. For some individuals, we see repeated questioning. So they might ask the same question over and over again. And it might be often a difficult question for you to answer. So it might be they're fixated on, where is my mom? And you might happen to know that their mother is, already passed. So that repeated questioning can be challenging. You might see individuals who are rummaging or searching. Sometimes they can't really articulate to you what item it is that they're looking for, but they engage in this over and over again. For some individuals, we might see what we call finger tapping. So they might be, tapping on a table or another item that's around them, or we might see them constantly, touching their hands, doing hand wringing in a repetitive motion. And then for some individuals, we see repetitive speech or vocalizations. So things where they're saying the same sentence over and over again, or even the same word over and over again. Maybe it's not something that is relevant to the conversation that's happening around them, or maybe it's not in response to a question that you've asked them, but they're constantly saying the same sentence, phrase, or word over and over again. We also see that sometimes individuals engage in repetitive object manipulation. They might have a newspaper out all day and they're constantly, maneuvering through the newspaper. Or it might be something where they have a water bottle and they're constantly, taking the cap off and putting the cap back on. So constantly, engaging with that particular object and trying to do something to it. We might see repetition in terms of rocking or swaying, or in general, just a movement, much like hand wringing, where they're constantly engaged in this one type of behavior over and over again. For some individuals, repetitive behaviors really manifest in hoarding or collecting things, sometimes things that are not of significance. So things like newspapers, where they're keeping all of the newspapers, or perhaps even going through the trash or recycling and collecting items from there to hang on to. For other individuals, we often see that the repetition is really focused on mirror checking or mirror related behaviors, really constantly, if there's a mirror in the space, the environment that they're in, going up to that, checking it, being very confused or disoriented, or sometimes overwhelmed by what they're seeing because maybe they don't recognize themselves. So all of that can be very challenging. And then last but not least, in some individuals, we see ritualistic behaviors. And those are the types of repetitive behaviors that an individual feels like they have to engage in before they can move on to another task, or maybe they have to do a set order of operations, like washing their hands 3 times, or rearranging their room before they come out for a meal. So things like that. So we call those ritualistic behaviors because in order for the person to move on to the next task, they have to complete that, order of operations, so to speak. And those are just some common repetitive behaviors that we see with individuals with Alzheimer's disease and related dementias, but there's also a number of other, related behaviors that you might be experiencing in your work. We term repetitive behavior anything that an individual is engaging in over and over again, and again, sometimes without true or apparent purpose for doing so. So again, this makes it very difficult sometimes for us to uncover what's causing this. In general, when we think about, why individuals with Alzheimer's disease might engage in repetitive behaviors, some of it has to do with that memory loss that they're experiencing, being disoriented, being confused. And so sometimes they're asking us the same question over and over again because they don't really remember that they've already asked us that question. In some situations, it's a communication difficulty. So they're asking the same question over and over again because they're not asking it in a way where you can answer it appropriately, or perhaps maybe they're really struggling in terms of better understanding, what's going on around them. So communication difficulties can manifest often as a result of these things going on with the individual related to their dementia diagnosis, and often that can happen as a repetitive behavior. The other thing is that for some individuals, these repetitive behaviors are due to maybe a lack of routine or structure, or that feeling as though they need a routine or structure, particularly as their condition, as they move forward in the journey with having Alzheimer's disease or another type of dementia. Some of those things that they were often able to do independently, they're no longer able to do. And so they're craving that routine that they once had, or that structure they once had. Or maybe they're even remembering back to when they used to work, for example. And so they had a certain routine that they were adhering to every day, and that's gone. So that can be a struggle for them. For some individuals, it's more of the sensory stimulation piece. Maybe they're bored, and they don't know how to articulate that, or they don't really know what to do. So they're engaging in this repetitive behavior because it's, comforting to them, and they don't know what else to do in order to, fulfill that need. For other individuals, anxiety and discomfort can be, a huge piece of the puzzle. You might see individuals engaging in repetitive behaviors, once again, to calm themselves if they're feeling anxious or if they're feeling discomfort with their surroundings. And so that can be a huge piece of the puzzle as well. For other individuals, it's this expression of emotional distress. So they might focus in on one question that they're asking you over and over again. And part of that could be due to they don't know how to articulate this way that they're feeling. So going back to that example I gave earlier about individuals who might ask, where's my mom? And that their mother has passed away. Some of that is that perhaps they don't know how to say, I miss my mom, or they're feeling like somebody is missing in their life. And so that's creating this emotional distress for them. And they don't really truly know how to articulate that. So it manifests as this repetitive question that, is seemingly something that they're, wanting just that answer to that piece, but it's actually part of a greater feeling that they're dealing with. And they don't really know how to, work through those emotions. So let's take a deeper dive into some of these areas that can contribute to repetitive behaviors for individuals with Alzheimer's disease and related dementias. As we already know from the first module, this particular condition really affects memory and cognitive functioning. Therefore, individuals might often exhibit repetitive behaviors because they forget that they've already performed a particular action, or they've engaged in a specific conversation. So they go back to that over and over again. They may repeat tasks or repeat questions as a result, and it's simply related to that memory loss component of what's going on with them. For some individuals, as it relates to communication difficulties, as the disease progresses, individuals might have challenges in expressing themselves or really understanding others. And these repetitive behaviors can really serve as a form of communication, or an attempt to convey this need, or express, even just very simple frustration that they might be dealing with. And so we see that repetition in them asking that same question over and over again, because they're not really getting the response that they need, or they might be frustrated about a particular area of, part of their life. And so they're asking questions repeatedly about whatever that is that's going on for them. As it relates to routine and structure, we know that maintaining a routine and adhering to familiar patterns can really help individuals with Alzheimer's disease and related dementias feel more secure. It helps them feel more in control. It might help with their feelings of that loss of independence as well. So for those days where they might not have that structure, or something else is, something disrupts that routine. Maybe they have a doctor's appointment. Maybe there's new faces who are in the mix providing care, or maybe family or friends are coming to visit them, and that's not, a normal part of those particular people, are not part of their normal routine. That disruption can really contribute to repetitive behaviors. So we know that these repetitive behaviors may stem from that desire for structure and predictability in their days. So really something to consider in the care that you're providing, and how important structure and routine can be for a person with Alzheimer's disease or another type of dementia. As it relates to sensory stimulation, we know that repetitive behaviors can also be a response to sensory stimulation or sensory overload. So individuals might exhibit these behaviors when they're in an overwhelming situation, like going to a restaurant, or maybe being in a group setting for mealtime, or maybe participating in some sort of activity where it's a group setting. So engaging in repetitive actions may provide sensory feedback or help individuals focus their attention on a specific sensation. And that could be why they're engaging in that particular activity over and over again. A lot of individuals, as we discussed in Module 1, really deal with anxiety and discomfort, particularly in unfamiliar settings or new settings. So we might see repetitive behaviors as a result of them feeling that anxiety or discomfort related to the surroundings, their environment, general confusion that they might be dealing with about a particular situation, or difficulty really just understanding the environment around them. For some individuals, really providing that they are struggling in this area, engaging in repetitive behaviors can be self-soothing for them. So it might provide them with a sense of familiarity and security, and might help them feel like they're alleviating that anxiety. And then last but certainly not least, Alzheimer's disease can really lead to that emotional distress that we talked about earlier, those feelings of frustration, agitation that really can manifest for individuals. Think about if you could not communicate or understand your environment, some of that leads to emotional distress. Also, for some individuals, we see that simple boredom, not having meaningful days can be distressing for them. And so, these repetitive behaviors that they're dealing with might be a manifestation of these various emotional states that they're dealing with. And this might be their way of coping with that, or attempting to really alleviate or negate some of those negative emotions that they're feeling. So as I went through the overview of repetitive behaviors, you might be thinking, oh, I've definitely worked with somebody over the years who has dealt with some of these areas of concern, some of these challenges. I would like you to take a moment to pause the video and reflect on how these situations played out in caregiving. I really would encourage you to think about, one, what those behaviors look like, some examples that you've seen in your own work, and how you responded to them as the person who was in charge of caregiving for that individual. And really take that moment to just really think through some of those situations before we move forward with our remaining part of this module. And now that you've had time to really think through some of those situations that you've encountered as part of your caregiving journey, I would like you to think about how you've traditionally handled these behaviors. How have you handled those repetitive behaviors that persons within your care have exhibited over time? So take a moment and reflect on that before we move forward with some of our other parts of this module. So now moving forward, I think it's really important for us to go back to one of those critical pieces of working with individuals with Alzheimer's disease and related dementias that we talked about in Module 1. And that's really taking that step back and understanding the why behind these behaviors. Really thinking about those things that we talked about earlier in this module about why repetitive thoughts and behaviors might happen for a person with Alzheimer's disease and related dementias, and thinking about how we can prevent these from happening, but also if they are occurring in a person you're providing care to, really thinking about how we can better manage those challenges associated with this particular manifestation of their disease. So let me take you back to some of the things we talked about in Module 1, which is understanding the why behind behaviors. So really thinking about the what piece of the puzzle. So we know obviously an individual that we're working with might be having these repetitive behaviors. Let's take a step back and think about what's causing that. Is there a specific situation or context that's occurring around them where you're always observing these repetitive behaviors? So whether that be asking the same question over and over again, or wandering or pacing during certain situations, or perhaps the individual is also really struggling with some of those other movement related behaviors like wringing their hands or doing the finger tapping as a result. So we really want to take that step back and try and figure out, what it is exactly that's causing these challenges for the individual. We also want to identify how we can help the individual. So really identifying once we've done that deep dive into the what of the situation, what are those interventions that we can put in place to help them to really focus in on those strategies that align with the values and preferences of that individual, of what matters most to them as an individual, and really figuring out, how can we make this work and be very person-centered, both in our communication, but in the interventions that we offer the person as well. We also want to, as the caregiver, really check in with ourselves and figure out, is there anything that I'm doing as this person's caregiver that's really adding to the situation unnecessarily? So really taking that deep dive into our own emotions, especially if we're frustrated or feeling, agitated about the situation, and trying to figure out how to deal with those as well. So let's start by talking about the why behind behaviors with using a case. So let's meet Miss Julie. You're working with Miss Julie, you're providing care to meet her, very basic daily needs. As we discussed, this is really, really important for persons with Alzheimer's disease and related dementias. But one of the repetitive behaviors that Miss Julie is exhibiting is that she's very fixated on lunch and repeatedly asks what's for lunch and really wants to know the plan associated with lunch. So it feels like every 15 minutes she's coming to you as the person providing care to her, and she's asking, what's for lunch? What is our plan for lunch? What are we doing for lunch? And she tends to dominate your time because of this. She does not redirect easily when you try to just tell her simply, what the plan is. And it makes it difficult to get other tasks completed. So this is a very challenging behavior that you're dealing with. Now, let's step back and also say that this is sort of what we would call a, not a really problematic behavior in general. It's not like she's picking at her skin or doing something that is involving other individuals. She's asking a very simple question, but it's hard to redirect her off this topic. And she seems very anxious, distressed, and very fixated on this concept of lunch and what you're going to have for lunch. And so much so that, from the time she gets up in the morning to when she goes to bed, she's constantly asking this question. And so it's becoming quite the challenge for you as the person providing care to her. A few more things that I think it's really important to highlight here is it's important to note that Julie had lived with her mother until she passed away 5 years ago. And really, Julie started exhibiting this behavior shortly after the passing of her mother. Prior to coming to the facility where she lives now, she had lived with her brother, and he had also noted this behavior as well, and sort of tried to figure out ways to manage it and sort of ignore it because he wasn't sure what to do. Once again, simple redirection or answering the question does not seem to work in satisfying her needs. It's really important to note that, we always try to redirect when possible when we're dealing with repetitive behaviors, but sometimes that's not always the case that strategy works. So when it doesn't work and we're noticing individuals are in distress or they're really struggling in this space, it's important to kind of take a step back and kind of consider what those other needs might be. And so really thinking through what this might look like for Miss Julie, what are some of those things that we can do to really kind of focus in on the why behind behaviors. So I'd like you to pause now and really reflect on, how would you use the why model with her? What are some of those things that you might consider doing with her that could really help alleviate that stress that she's exhibiting, really try to better manage that repetitive behavior. So let's pause now and think about that before we move forward. Now let's work through another example together, focused on repetitive behaviors and how to deal with some of the challenges associated with those. So let's meet Mr. John. Much like other persons with Alzheimer's disease and related dementias, he has a multitude of repetitive behaviors that he has started exhibiting. Just something of note, he has dementia with Lewy bodies and requires a lot of hands-on support just to get through, his activities of daily living, but also to communicate with others around him and express his needs. Lately, he has been showing a couple of different repetitive behaviors. These have included sorting and rearranging. He frequently engages in repetitive sorting and rearranging of objects in his room. So he has a very small desk in his room. So he's constantly rearranging the items that are on the desk, organizing, his clothes, taking everything out of the dresser and putting it back in. He spends a significant amount of time every day performing these activities, and he gets frustrated if you try to interrupt him while he's trying to engage in this activity. So it's almost like he's also showing some ritualistic behaviors, meaning that he can't just stop what he's doing. He has to get through that task before he can really move forward with some of the other activities of daily living that he needs to engage in. He also has been exhibiting some verbal repetition, particularly repeating certain phrases or questions multiple times during conversations and throughout the day. Sometimes this can be disruptive for those around him, just because he shouts those words that he's repeating over and over again, and sometimes it seems like he's very frustrated or angry when he's having to repeat those verbal words over and over again. He also, and this is the most severe repetitive behavior that he's engaging in, but he's really dealing with skin picking as well. So he has been focusing on specific areas of his skin, especially his arms and hands, often picking so much that he's leading to minor abrasions or skin irritation. And you, as the caregiver working with him, are really concerned about infection, but also just the fact that this seems to be really problematic for John. He often engages in this, whether he be alone in his room or sometimes when he's in group settings as well. He will sit, instead of engaging with others around him, he'll pick at his skin. So let's take a moment and pause here and think through the why behind the behaviors. What's causing his distress? Can we identify or pinpoint some of those things that we talked about earlier in this module that can be contributing factors for him engaging in so many repetitive behaviors? Let's think about how we can help him. Let's try some strategies that align with things that he might like or prefer. Now, at this stage, we don't always know, especially when we're new to working with someone, what those things that matter most to them are. So sometimes it's trial and error. We're throwing that spaghetti up against the wall and trying to figure out, what's going to work in this particular situation with this individual. And once again, sometimes trial and error to figure out what those different things are that are going to work for that individual. And then last but not least, always checking in with ourselves as the caregiver, as the person really providing the care to this individual, to see if anything related to our emotions are really causing additional distress for the person we're providing care to. So let's start by focusing on the what is going on with John. Let's go back to the fact that some of this could be memory decline. Some of the problems associated with him having dementia, especially related to the repeated vocalizations, the repeated question asking that he's doing. Does he not remember asking those questions or saying those same sentences or phrases over and over again? In some situations as well, related to that repetition of vocalizations or the shouting, could this be an emotional response that he's engaging in? Is he becoming frustrated because he cannot communicate with those around him, or he's attempting to communicate with those around him and they're not quite understanding? So as he's repeating himself as he goes further and trying to express himself, and so this is more of an emotional response. On the backside of that, it's also important to consider that some of these other activities that he's engaging in, like the repetition in his room of reorganizing, rearranging constantly, that could also be an emotional response. It could be that he's, still trying to acclimate to his new surroundings. Maybe he's looking for something, but not quite sure what it is. So he's organizing or sorting through his stuff, looking for whatever that item is. And that could be due to that feeling of, something's missing, or I don't quite understand this environment or the space that I'm in right now. And so really understanding that that's a key piece to the puzzle as well for him. So some of this could be attributable to this emotional state that he's in. Recall from Module 1, we talked a lot about the suffering that individuals with Alzheimer's disease and related dementias often deal with, especially as they progress with this disease, as they understand that they're losing different parts of their, daily routine and different parts of themselves because they're not able able to do some of those things that they once were able to do, and really need that additional support. So really thinking through, could this be an emotional response that he's dealing with? In some situations, we might want to step back and say, it seems like he might be spending a lot of time in his room independently. Does he need more attention? Does he need one-on-one time with a staff member? Or do we need to see if, there are any other residents or others, if he's still living in the community, that might need, that we could pair him with to provide him with that additional support that he might need, especially if others around him have similar interests to him, and try to engage him in that way. Additionally, if we're noticing that this is happening in group settings, really thinking through, is this a situation where, he's anxious or nervous about this situation? If he's picking at his skin, especially if he's in a group situation, it could be that he's, experiencing some anxiety. He might not know what to expect in that group setting, or because he's unable to communicate and might not know how to follow along with the conversation around him. That might provoke some anxiety within him as well. He might also be dealing with some feelings of boredom, and this might be him trying to show that he needs more engagement, that he needs, additional support to address some of these facets of his life. So it's really important for us to take this moment to reflect. The other thing that I would like to just highlight once again is really kind of isolating, especially because he's showing 3 different repetitive behaviors, right? So obviously something's going on. Can we isolate each one of these and think through, is this happening before a specific event or specific activity, or is it happening more when he spends significant time alone? So really thinking through, where is this occurring? Where are we observing as staff, the people working with him, that he's really dealing with some of these repetitive behaviors? So it's always important for us to kind of do this, discussion, even with other staff who might be working with individuals with Alzheimer's disease and related dementias, to see if, we can isolate what events are occurring right before the repetitive behavior starts, or that individual is engaging in that repetitive behavior. So now let's move on to the how. So how can we reduce some of these challenges that John seems to be dealing with related to his repetitive behaviors? So we want to think about perhaps an environmental modification, especially related to the sorting and the reorganizing that he's doing in his room. It could be that he's really needing an activity to do, and that's okay. That's not really hurting anyone, right? And it's not necessarily a negative behavior, and it's giving him something that he feels like might be meaningful to him to do or engage in. So maybe we think about designing a sorting and organizing area so that he can engage in this. It might, or we might consider also thinking about objects that are meaningful to him, that allow him to engage in this sorting or rearranging activities without disrupting other areas of his living space, especially if, when he's sorting and reorganizing, if he's creating a mess, really thinking about how can we turn this, repetitive behavior into sort of a more productive activity where he's engaging in something in a meaningful way. We might consider, even utilizing tools like different puzzle pieces, and seeing if he can reorganize those. Probably the first time you do something like that, really monitor that engagement, just to make sure that he's not getting frustrated by whatever it is that you're giving him. The other thing you might consider too is if he's looking for this more meaningful activity where he needs something to do, and it's also seemingly related to boredom. In some situations where I've worked in other facilities, we've considered doing things like having residents who wanted to engage in these different activities like folding laundry. It gives them something meaningful or productive to do, and also gets out that boredom, and they feel like they have a task that they have ownership on. Now, sometimes this means, they get through that task very quickly. So you might have to, go into another room and reshuffle the laundry or whatever it is that you've had them fold and bring it back. Even if it's just, pieces of material that you're having him fold or organize in a certain way, that can be helpful as well. But giving him something to engage in that allows him to release this kind of energy that he's exhibiting to you can be really, really helpful as well. And the other thing I want to say about repetitive behaviors is in some situations, we want to think about, is this really a negative behavior or is it a self-soothing behavior? Is it decreasing their boredom, even if it is repetitive? Not all repetitive behaviors are bad. They're not always going to cause a disruption. So if that's the case, let's figure out a way to make it meaningful for the individual and really help them engage in that way. The other thing we might consider too is redirection and distraction techniques. Now, in our previous case that we discussed with Miss Julie, that had already been tried and didn't work, so we had to move on to something else. But with John, we haven't really tried that yet. So really thinking about how we can use redirection to divert his attention from the repetitive behaviors. I think this would really fit well if you're thinking about the verbal repetition that he's engaging in, especially if it's the shouting or the saying the same question over and over again. You might find alternative activities to help focus his attention, thinking about things that might be of interest to him. So this really requires you as the caregiver to kind of pause and think about things that you've seen him show interest in or that you've observed him show interest in. And so really thinking about, what those items might be or those tasks or activities might be and try to engage him in those. You might try things like, engaging him in art activities where he had, it's more of a tactile kind of activity, so he can use his hands, he can get that energy out and also express himself in a way that's more appropriate. You might think about when he starts the repetitive questioning, try to bring it back to something else, especially if he seems to be fixating on a specific topic or a specific thing. Really trying to redirect him to some other avenue and have that meaningful conversation with him. Sometimes we see that individuals who are dealing with repetitive behaviors, in particular repetitive questioning or statements, are looking for something. They're trying to satisfy this need. And sometimes, as I mentioned earlier, it's not always the exact question that they are asking us that they're looking for that need from. So we need to sometimes pause and think about what are those things that could be related to this. Much like with Miss Julie, if you recall, she was asking about what's for lunch over and over again. And, it really wasn't about lunch. It was about the fact that she was missing her mother and that special time that they had together. And so really taking that step back and saying, okay, could this be related to something that's meaningful? Is it a much deeper kind of line of questioning that helps us better understand that individual and what matters most to them and what's important to them? We might also want to consider the fact that, especially related to the skin picking piece of what's going on with John, that he might be dealing with some anxiety and some stress, and that could be for various reasons. It could be that you're noticing this more within group settings when you're trying to engage him in mealtime with a group or different group activities. So really thinking about what are those things that we can do to help prevent that from happening. If that's the case, you might want to think about smaller group activities that involve John versus him being in a much larger group of, 10 or 12 people. If you notice that it's happening more when he's alone or spending time in his room independently, you want to give him obviously that chance to be, on his own, to be independent. However, really making sure that we monitor, his boredom levels and making sure he's not spending too much time alone, if that's what we're noticing as it relates to the skin picking piece. Some other activities you might consider is if you notice, he's having a really bad day and He does seem very outwardly stressed, and he's engaging in a lot of skin picking. You might think about working with him to do some deep breathing exercises, or play relaxing music while you're engaging with him. And so really trying to promote that sense of calm for the individual, because that can be really helpful as well. And last but not least, we want to focus on you as the caregiver. First off, much like with Miss Julie, we want to acknowledge that hearing the same thing over and over again can be very frustrating, even if it's not a really negative question, or it's something very light, like what's for lunch. At a certain point, I think that we're trying to move forward with helping an individual with those activities of daily living, and so therefore, hearing the same thing over and over again can be just really frustrating. So we need to acknowledge that. And create space for ourselves to to say, I'm frustrated by this. I might need to step away for a moment and take a deep breath. I think the other thing we need to acknowledge in this situation with John, and this could be true for other individuals in other situations where you're providing care to them, really seeing self-harm, such as the skin picking in a person you're providing care to, can be very overwhelming. There are, a lot of concerns, especially related to germs, infection, and just knowing that they're that anxious and that overwhelmed and stressed, that they're engaging in that behavior, can be overwhelming to us as the caregiver. So we want to make sure, if this is happening, sometimes we need to take that step back and acknowledge how we're feeling, and then take that deep breath, really think through what are some of those things that we can put in place with the individual. And in some situations, we might need to seek support from our colleagues who are around us, really kind of vent those frustrating moments or those feelings of being overwhelmed, because sometimes if we try to just move past that and not acknowledge how we're feeling, it only makes the situation worse, because we're really focused more on let me just get through this task, right? And I'm not going to worry about that part. The other thing, just to reiterate, and I know I've said this several times during the course of the first module and this module, but I'll continue to do so because I think it's a really important point. Even if you don't say you're frustrated, a person with Alzheimer's disease and other types of dementias can really pick up on your body language. So it's really important for you to think about those self-care techniques that you're engaging in on a regular basis that really help you, fill your cup, so to speak, or recharge your own batteries. Because if you're in a situation where you're dealing with some of these very complex repetitive behaviors, it can often be frustrating for you, and so really making sure you're taking care of yourself, and making sure that you're prioritizing that in your personal life as well. So in today's module, we covered some of the repetitive behaviors that you might see with persons with Alzheimer's disease and related dementias that you're providing care to. I want to add to this that you might see other behaviors as well that are, as it relates to complex questions, that you'll hear over and over again. For example, where is my mom? Or I want to go home. Some of those are very difficult to answer, right? You can't just give us a straight answer to some of those questions, because it might add or exacerbate some of the distress that individual is dealing with. So what I often recommend from a compassionate care standpoint related to that line of questioning is to really think about the emotional state of that individual, really think through, why is this person asking this question? Are they wanting, for example, if it's where's my mom or where's my dad, someone who's passed away many years before, you might want to focus in more on the emotion piece, really try to, in some situations, answer the question with a question. So for example, when you hear the where is my mom over and over again, or where's my dad or my sister, whoever that person is that was meaningful in that individual's life, really try to reframe that conversation, and pivot towards a conversation about that individual versus answering the question. If the person doesn't remember that their loved one is deceased, telling them that over and over again is only going to re-traumatize them or cause them additional stress. So it would be much better to engage with them by saying something like, I'm not sure, But, tell me about your mom. What did she do when she worked? Was there any, special trips that you went on together that you remember that you want to share with me? And so really try to engage them in that way so that they're able to really express themselves, express that emotion that they're feeling. And at the heart of those types of questions, when an individual is asking about someone who's deceased, a lot of times it's that maybe deep down they might know that that person's just missing from their life in this moment. They might not quite understand that they have passed away. And so it's really important for us to really focus on that emotion and allow that individual to share some of their experiences with that individual, really share some of those experiences that they had with them, and give them that opportunity to express themselves. The same goes with the I want to go home. I've worked with many individuals, especially in nursing facilities, who, they're perfectly fine during the day, maybe don't exhibit repetitive behaviors. They're engaged in activities. They have, meaningful interactions with staff and other residents. But then when it's time to go to bed, they, constantly say, I want to go home. And so a lot of times what that, is their kind of need to express themselves about this feeling of not really being sure where they're at, especially if they've just moved into a new facility or they've changed rooms. And so really allowing them to express themselves. So, when you're hearing that phrase over and over again, you might ask them to ask them to tell you about their home. Let them describe that. See if you can kind of harness, are there any familiar items that they seem to be missing when they start describing what that looks like? Maybe things that the family could help incorporate back into their space. I know a lot of times what happens is when individuals move to a new facility or maybe a new unit within the facility, the family doesn't always bring, obviously, everything from that person's home because for logistical reasons, it's obviously not going to fit. But sometimes some of those meaningful things or familiar things that individual is really craving or missing is left out. And so trying to see if you can glean from that conversation if there's something that is important to them in their home when they start talking about it, that can help you bring those familiar items back in. Because a lot of times that I want to go home is that they're confused about where they're at. They're confused about this new space that they're in. And so sometimes within those transitions of care, we really need to think about those familiar items that are important to that individual. You might also be dealing with individuals that are focused on completing certain tasks before they do something else. So we think a lot about those ritualistic tasks that individuals feel like they have to complete before they sort of move forward with their activities of daily living. So you might see things like repetitive washing of hands, or an individual wanting to shower more frequently, or in some situations doing like Mr. John did in our scenario earlier, really focused in on that reorganizing and that sorting aspect of their daily routine. And a lot of times for individuals, that's them also really craving or needing that routine, that structure to their life. And so you might see them engaging in activities like that on days where their routine is thrown off. And routines can be thrown off by even fun things, like maybe you're having a different group that day, or you're doing things differently in the group activity that day. Or in some situations, maybe a family member has come to visit that day and that's not normal for that individual. And so they're engaging in sort of that behavior because they're trying to, regain that sense of control that they might be wanting in their lives and they feel like it's missing. So in those situations, it's really important to think about what's contributing to that repetitive behavior. One suggestion I might have, if you're noticing individuals are engaging in that type of behavior and it's related to perhaps they live in a facility and you're noticing the repetitive behavior anytime a family member comes and that's not part of their normal routine, you might consider maybe in their room having something where you kind of have the schedule of the day, and if a family member is coming, you have a picture of who that person is that's coming to visit, because that can be helpful as well. Now that requires some level of coordination with the family, but making sure that you explain the purpose and intent can be helpful as well. Additionally, we've also seen some of these ritual type behaviors or these repetitive type behaviors when we have staffing changes as well. So individuals might be engaging in this repetitive behavior because even though they maybe have lived in that particular facility for a while or that particular unit, they haven't changed rooms. That constant change or turnover of staff can cause them to want to seek comfort, or want to engage in these repetitive behaviors for that reason. So I recommend that, if you're working in a facility and this is the case, making sure you have photos of whoever's going to be on shift that day, from the staffing point of view, because that can be helpful in terms of really just engaging individuals, and making them feel a little bit more calm and comforted, because they know what to expect. Another situation I've encountered, especially in nursing facilities, is when you have perhaps an influx of new residents who are moving in. And so once again, that can be disruptive to individuals' routines. So making sure that, you introduce residents to each other. If there's an opportunity during the activities of the day for you to play a game or do introductions, and do them on a regular basis until everyone gets used to each other, that can also add to a more calming and comforting environment for the individual and potentially prevent or decrease some of these repetitive behaviors that we see. Another thing of note related to repetitive behaviors, sometimes we see individuals who have access to telephones or smart devices making excessive phone calls to family members or friends out in the community. And so that's also, one of those situations where an individual is looking for comfort. They're looking for that familiar person, right? So some of these other things that we've talked about that can be helpful for repetitive behaviors as a whole can really help decrease that as well. And then lastly, I want to say that, in some situations we see that repetitive behaviors are combined, much like with Mr. John, where individuals are engaged in a number of things all at once. So I once worked in a facility where we had a resident who paced quite a bit. But in addition to the pacing down the hallway, this particular person liked to touch the wall as they paced. And, that created some issues. One, we were worried about falls risk because she was a little unsteady on her feet already. But two, the touching of the walls, the concern about spreading of germs. It was also creating kind of a rub on the wall, a marking on the wall as well. That was problematic. And so, just thinking about if an individual is doing something like that, where they're engaging in multiple means of self-soothing, really taking that step back and thinking about what are some ways in which we can engage this person in a more productive or more meaningful way. In the particular situation that I just described, what we ended up doing was giving this resident more engagement via task, where it was a tactile kind of task where they could fold laundry, or they could play with puzzle pieces and walk around, really giving them that opportunity to engage in something that was a little bit more meaningful, but also tactile, and got that need out for them to touch various items as well. So these are just some other examples that I thought might be helpful in terms of thinking through repetitive behaviors and some ideas for how to deal with those. To conclude this module on repetitive behaviors, let's recap quickly. So we discussed what repetitive behaviors are, some things related to them that you might need to know in providing care to a person with Alzheimer's disease and related dementias. We talked about some of the reasons why individuals with Alzheimer's disease and related dementias often exhibit repetitive behaviors. And then we focused on a couple of different cases, really focusing on looking at the why behind behaviors, looking at what's causing the person's distress, identifying how to help them, and then really thinking about ourselves as the caregiver and how we can do a check-in with ourselves. I really encourage you to spend some time at the end of this module thinking about how you'll use this information in your own caregiving experience and how you'll really think through the why model in managing and even potentially preventing repetitive behaviors for individuals who you're providing care to in the future. Don't forget at the end of this module to make sure you complete the post-test for credit.